rheumatologist, and we are going to talk about the rheumatoid arthritis antibodies, RF, and CCP. Normally, your immune system protects you by recognizing foreign invaders like bacteria and viruses and attacking them. Antibodies attach to these foreign invaders and form something called an immune complex. This immune complex then triggers your body's natural alarm system. In autoimmune diseases like rheumatoid arthritis, your body creates antibodies that mistakenly attack itself. RF and CCP are two of those self-attacking antibodies. Now, your body naturally modifies proteins in a process called citrullination. In rheumatoid arthritis, your body sees these citrulinated proteins and makes antibodies against them. When rheumatoid factor attaches to these citrulinated proteins, it forms immune complexes that triggers a very robust inflammatory response. In normal people, your immune system is trained from birth to recognize yourself from non-self, and you develop something called tolerance. In people with rheumatoid arthritis, something causes this tolerance to break down, and this usually happens years before you develop joint pain and swelling. This process doesn't typically start within the joints, but rather in mucosal surfaces, which are the moist linings of the lungs, the mouth, the gums. This is why smoking is such a huge risk factor for rheumatoid arthritis. It's why gum disease has been linked with rheumatoid arthritis, and it's also why changes to the intestinal bacteria have been linked with rheumatoid arthritis. Now, some people have these antibodies floating in their blood for years and they never develop joint pain and swelling. So what tips the balance between having positive antibodies and having full-on rheumatoid arthritis? Several factors seem to matter. First, if you have both antibodies, RF and CCP, then you are more likely to have more aggressive rheumatoid arthritis. If the levels of the antibodies are higher, like greater than 3 times the upper limit of normal, then you are more likely to develop rheumatoid arthritis. If you have elevated markers of inflammation in the blood, like C-reactive protein, plus an RF and CCP, you are more likely to develop rheumatoid arthritis. And lastly, of course, genetics. If you are genetically predisposed and you have an RF and CCP, then you are more likely to develop rheumatoid arthritis. Important things to remember, you can have rheumatoid arthritis even in the absence of RF and CCP. Also important to remember, you can have a positive rheumatoid factor for reasons other than rheumatoid arthritis, like Sjogren's disease, certain infections like hepatitis, for example, or infective endocarditis, and also certain types of cancers. If you have a positive RF or CCP and you are not having joint symptoms, the best way to kind of try and prevent the development of rheumatoid arthritis is 1, don't smoke, 2, make sure you maintain good healthy gums by brushing your teeth and flossing, and 3rd, eating a good healthy diet with an adequate amount of fruits, vegetables, legumes, nice healthy food that can maintain your gut microbiome.